My name is Clarissa Gonzalez, and I'm here to tell you that the thyroid gland is a vital hormone gland, yet people tend to ignore it when it's not functioning correctly. Since I was 11, I've heard the term hypothyroidism in every single doctor's appointment I've been to. That's because it has had a huge effect on not only my medical history, but the way my body works and looks on the daily. I had this disorder for 5 years that I know of, but my doctor said that I had it for far longer than that. Thyroid problems go seemingly unnoticed, but the truth is that most of us don't know how to correlate the symptoms and recognize a condition like hypothyroidism. The more information on the subject we have, the easier it'll be to identify and treat. Hypothyroidism describes an underactive thyroid gland. This disorder can have severe consequences if it's not treated. In order to be able to recognize and properly diagnose this disorder, we need to know what it's really about. So first, the medical definition would be, as I mentioned before, hypothyroidism that refers to an underactive thyroid gland, which means that your thyroid is not producing enough thyroid hormones to keep your body running normally. The thyroid is an endocrine gland that's located in your neck and has like a butterfly shape. It produces two hormones that go into your bloodstream. That would be T4 and T3. T4 and T3's basic function is to regulate the speed at which your body works. That would mean your metabolism, your temperature, and your heart rate, amongst other things. So when you have hyperthyroidism, your body doesn't produce enough T4 and T3, and that's not good. But how can we tell that our thyroid isn't falling behind? Well, when you have hypothyroidism, your body slows down, so you feel colder and your heart rate slows down. You also get tired and fatigued easily. Other symptoms are depression, elevated blood cholesterol, pain in joints, fatigued, weight gain, hair loss, slowed growth rate in children, fertility issues, difficult periods in women, and other things like hair thinning, liquid retention, etc. Now that we have a better understanding of hyperthyroidism and its symptoms, the thyroid gland and its hormones, we'll need to know what causes it. So there are three types of hyperthyroidism: primary, secondary, and tertiary. But we'll only talk about our primary hypothyroidism, which is when your thyroid is being stimulated properly by your pituitary gland, yet it doesn't produce enough hormones. The most common causes for primary hypothyroidism are autoimmune disease like Hashimoto's thyroiditis, which means that your body starts attacking your own thyroid cells. Surgical removal of part or the whole thyroid gland. So because you are missing a part or you're missing the whole thing, the production is never enough. Then it's radiation, that some patients that have been through radiation treatment can lose part or all of their thyroid function. Then it can get congenital and hereditary, which means that you're born with it or you're more likely to get it because your family had it. And thyroiditis, that is an inflammation of the thyroid gland that causes hyperthyroidism and other issues. Now, the diagnosis and treatment. The symptoms are so variable and non-specific, the only way to know for sure whether you have hypothyroidism or not is with a simple blood test for TSH. If your TSH levels are high, it means that your pituitary gland is producing more stimulating hormone to try and get your thyroid to start working. High TSH means high hypothyroidism. So once you've been properly diagnosed, you will start taking levothyroxine in pills, which is a synthetic version of T4 hormone your thyroid gland was supposed to be producing. When you take this medicine, your hormone levels start to adjust. The correct dose is determined by trial and error until the TSH levels are neither too high or too low. If hypothyroidism goes untreated for a long time, it can cause nerve damage, heart disease, fertility issues, anxiety, depression, dementia, amongst other things. Actually, hypothyroidism is one of the curable causes of dementia. So now that we have a better understanding of hyperthyroidism as a serious condition, we've talked about the thyroid gland, its hormones, hyperthyroidism, and its symptoms. We also mentioned the types of hypothyroidism and its causes. Lastly, we briefly discussed diagnosis and treatment. So I hope that this information brings awareness to the importance of having a healthy thyroid. Thank you.